Now, skull. Let's discuss skull. I'll do this in two parts. It will come of 3 marks. Okay. The first part of the skull, that is very easy actually. Norma frontalis. The bone looks like this, and it's just one labeling. Like the stick is gonna be like this. Okay, the stick is gonna be like this, and they'll ask what is this and the contents of this. So the answer to that is infraorbital foramen, and the contents is infraorbital nerves and vessels. Full marks. Okay. Next part. Norma verticalis, bregma and lambda. Now this is bregma. This part is bregma, this part is lambda. This is anterior, this is posterior. Okay. Frontal lobe and occipital lobe. Not important, but what is important is anterior fontanelle. What is fontanelle? It's a membranous tissue which is not yet ossified. Like after the baby becomes 18 months, if the baby becomes of 18 months, this membranous non-ossified tissue becomes ossified, and therefore this looks like this. Like this is an adult bregma. But till 18 months, जिसको ताल कहते हैं babies की, that's that. So it takes 18 months for anterior fontanelle to develop, and it takes 3 to 6 months for the posterior fontanelle to develop. Now how to remember this? Because B comes first in the alphabetical order, it will get the higher number. So 18 months for bregma, and L 3 to 6 months for comes later in the alphabetical order, therefore it will take 3 to 6 months, less number. Now an extra piece of information that will be helpful later, so just know it right now. Anterolateral fontanelle is also the same thing, in which the baby becomes 3 months, and therefore pterion. Why is this pterion? As the name suggests, pteri, it is made up of 4 bones. 4 bones. Which one? Greater wing of sphenoid, then temporal, and parietal, and frontal. These 4 bones makes the pterion. We'll discuss about this later. For now, just know that anterior yani आगे, lateral yani side में, fontanelle, which takes 3 months to develop. Okay. So now we know bregma, we know lambda. Infantile and closure time is anterior fontanelle 18 months after birth, posterior fontanelle 3 to 6 months after birth. Now we'll see norma lateralis. This is how it looks, norma lateralis. The first thing that you notice in norma lateralis is zygomatic arch. Now we already discussed this when we were studying masseter origin, because we were massaging like this, right? So again, this concept that I previously told you, bone to bone is joined by ligaments. Okay, bone to bone is joined by ligaments. This ligament is called temporomandibular ligament. So the bone that it attaches is zygomatic, and another bone is the neck of mandible. I'll show you where this is. It's right here, this neck of mandible, and the ligament joint is TM ligament. We'll discuss this later in when we already studied in mandible. Okay, so this bone is zygomatic, and this bone is neck of mandible. Okay, now this is one ligament. Another is of the zygomatic arch was masseter. So these are the 2 things that is involved in zygomatic arch. I don't think so they'll ask about this, but we should know. It's easy, yani. Next is mastoid process. Mastoid process we already discussed a lot many times before, that it's the insertion of the sternomastoid muscle and origin of the posterior belly of the digastric muscle. So we know mastoid process also. Very important anatomical feature is styloid process. Like this styloid process is gonna help us identify so many more other things, because it's so easy. It's the easiest thing to identify in the skull. This is styloid process right here. It's so conical, very easy to figure out. You can just figure this out just looking at it. This is very a spike kida, and it is so anatomically important, because around this there are so many things that you can understand. For example, mastoid process. We just studied mastoid process. This is the mastoid process. Okay, so styloid process and mastoid process we just did. Now styloid process has a few significance, because it has a attachments which are important. Now we'll discuss about these attachments in sagittal section also. Okay, later. The muscles attached to it I will explain to you here. Now this part of the is not that important because it's gonna come in your written neuro exam. But for practical, all you need to know is that the side of tongue, the posterior side of the tongue, has a muscle, is responsible for a muscle called styloglossus that attaches itself to the styloid process. Another muscle is related to hyoid bone and also goes through the styloid process, is called stylohyoid, and from the pharynx also, which is stylopharyngeus. So three muscles attached to the styloid process: styloglossus, stylohyoid, and stylopharyngeus. Now, what are the ligaments attached? Because styloid process is so much in style these days, the most famous brand for, when you look for style is H&M. Okay, favorite brand of so many people. Stylohyoid and stylomandibular. H, hyoid, and M is mandibular. So, stylohyoid, stylomandibular ligament. Okay, so, or the mnemonic responsible for styloid process, so much in style, H&M. Okay, it's easy to remember, very easy. Next, temporal fossa. We already did temporal fossa when we did the muscles, which is like temporalis muscle. Important PYQ. It comes so many times. Now, this pterion that we discussed before. This is like a major PYQ. I think it came in 196 batch only. The pterion. Okay. Pterion is responsible, as I told you before, frontal, parietal, temporal, and greater wing of sphenoid. That's what they asked. What I think, if they even ask again, they're gonna ask the artery. So I want you to visualize that there's a big ass artery coming out of this point called anterior division of middle meningeal artery. Take a screenshot of this so that you understand, like you remember it. This, like, there's a big ass, it just imagines like everybody has a big artery coming out of their of their head. It's called anterior division of middle meningeal artery. Okay, just imagine, it's just for learning purposes. Okay, now infantile clostridium we already did 3 months after birth. Let's come to lateral pterygoid plate. Such the most simplest form if they can ask is this, because it's so easy to identify. How? If they come, anything, this place is so crowded that anything marked here, you'll know they're asking lateral pterygoid plate. Anything marked, not importantly just this thing, because it's so confusing. What is this? Anything in this area, if they, except for the styloid process, of course, anything they mark here, just know that they are asking lateral pterygoid plate. And the only thing you need to mention in lateral pterygoid plate is two muscles, is lateral, obviously lateral pterygoid and medial pterygoid. Now the nerve for this is also in their names: nerve to lateral pterygoid, nerve to medial pterygoid. Very easy. Next is alveolar process maxilla, which is responsible right here. It's right here. This part of the maxilla is alveolar process of maxilla. And the importance of this is that it's, it joins itself to the muscle called buccinator muscle. You'll learn even better in neuro written exam, like it has upper part and intermediate part and lower part. This all muscle is buccinator muscle, and an offshoot of facial nerve is called buccal nerve that supplies nerve supply to buccinator is buccal nerve. Very easy. Now let's discuss this again, and I'll do externa and interna in the next part of this video so that it's easier to upload. So we know infraorbital foramen right here. We know bregma lambda. We know zygomatic arch from the masseter muscle and the ligament responsible. Mastoid process, we know two things which is very majorly important. Can come, this mastoid process can come actually. Styloid process, temporal fossa, pterion, we already did so many things related to pterion so many times. Lateral pterygoid plate also, two muscles, and alveolar process maxilla. Now I'll do the next part.